Motherhood is the most amazing experience a woman can have. Her whole universe revolves around her child. And when her child is in distress, her whole world stops.
I am Ambika, a mother of 8 months old baby. I'm Dr. Haripriya. I'm a second time mother of an 8-month-old baby girl.
I'm Indu. By profession, I'm an educational psychologist. But then I think when it comes to being mother or embracing the motherhood, each time it is different.
So she was born on November 9th. So that's when my breastfeeding journey started. But as all the other mothers, I also thought that the breastfeeding journey would be very easy. Breastfeeding அப்படின்னு ஒரு issue for a second time mother, it should go without a hitch. That's what we usually think. And for about 2 months, everything worked out fine. But 2 months in those 2 months, I did actually notice that I was having a lot of nipple soreness.
And this time when I was expecting, I thought of doing a lot of different things when compared to my son. And it all went shattered when I got my daughter and she was not feeding well.
The difficulties that I was facing when breastfeeding was I had wound இருந்தது. அதுக்கப்புறம் the baby wasn't latching properly at all. She'll be crying the whole night. We don't know what is the reason for it. And she had a lot of reflux issues and I wasn't able to put her flat on a bed. Those kind of issues showed up.
I was perplexed and I was puzzled. Where could it go wrong and what else I can do? I became a little depressed. My daughter wouldn't latch well and I had a very painful breastfeeding and I had a sore breast. I can go on and on.
Ankylosing, commonly known as tongue tie, is a congenital condition in which the membrane that connects the tongue to the floor of the mouth is so short that it restricts tongue mobility. 7 to 9% of babies are affected, but many continue to suffer because the condition is underdiagnosed. A baby with tongue tie cannot lift its tongue to draw enough milk. Ultimately, milk supply decreases, compounding the problem. This affects the baby's growth, facial development, and even speech articulation. It also harms the irreplaceable mother-child bonding that occurs during breastfeeding. Fortunately, tongue tie is easily reversible. A frenotomy immediately eliminates all these problems, and it takes just 2 to 3 minutes to perform. In fact, it is so simple that it can often be done without sedation or local anesthesia. The wonderful results, however, last a lifetime.
We all know breastfeeding and breast milk, how much it is important for a baby and mother. When mothers coming with breastfeeding issues like they are having severe nipple cracks, bleeding nipples. இப்போ பேபிஸை பார்க்கும்போது பேபிக்கு வந்து கரெக்டான வெயிட் கெயின் இல்லை, பேபிக்கு வந்து ப்ராப்பரான மில்க் ட்ரான்ஸ்ஃபர் இல்லை, வென் பேபி இஸ் ஆல்வேஸ் ஸ்லீப்பிங் ஆன் தி பிரெஸ்ட். இப்போது பேபிக்கு வந்துட்டு கரெக்டான அவங்க லேட்ச் பண்ணி குடிக்க முடியல, தே ஆர் அன்னேபிள் டு சஸ்டெயின் அ லேட்ச். இந்த மாதிரி இஷ்யூஸோடு வரும்போது then we are looking into the functionality of the baby's latch, அந்த டங்கையும் அந்த லிப்பையும் பார்க்கும்போது தான் we are suspecting lip tie and a tongue tie.
நான் இங்கே கோயம்புத்தூரில் மதர்ஸ்க்கு பிரெஸ்ட் ஃபீடிங் கவுன்சிலிங் பண்ணிகிட்ருக்கேன். பிரெஸ்ட் ஃபீடிங்னு யோசிச்சாலே முதல்ல ஆளுங்க என்ன சொல்கிறாங்கன்னா, இட்ஸ் வெரி ஈஸி, இட் ஷுட் கம் நேச்சுரலி டு த மதர். பட் நிறைய பேருக்கு என்ன தெரியாதுன்னா, பிரெஸ்ட் ஃபீடிங் இஸ் அ ஸ்கில். ஸோ லைக் டிரைவிங் ஆர் ஸ்விம்மிங் ஆர் சைக்கிளிங், தேர் இஸ் அ லேர்னிங் கர்வ். ஸோ அந்த லேர்னிங் கர்வ் கிடையில நிறைய விஷயங்கள் கேன் கோ ராங். அண்ட் ஃபர்ஸ்ட் வாட் பீப்புள் திங்க் இஸ் பிரெஸ்ட் மில்க் சஃபிஷியண்ட்டாக இல்லை மதர் கரெக்டான டெக்னிக் யூஸ் பண்ணல, கரெக்டான பொசிஷன்ஸ் பண்ணல, இதனால எல்லாம் தான் இஷ்யூஸ் வரும் அப்படின்னு தான் ஃபஸ்ட்டு யோசிப்பாங்க. யோசிக்காமல் விடுற விஷயம் என்னென்னா, பேபிக்கும் ப்ராப்ளம் இருக்கலாம், பேபினால கூட பிரெஸ்ட் ஃபீடிங் நல்லா போகாமல் இருக்கலாம் அப்படிங்கிற ஒரு ஃபேக்டர் பீப்புள் டோன்ட் திங்க் அபவுட் இட். இதனால தான் நான் வந்து பிரெஸ்ட் ஃபீடிங் வந்து ஒரு டயாட் மாதிரி பார்க்கணும் அப்படின்னு நாங்கள் சொல்கிறோம். ஸோ டயாட் அப்படின்னு வரும்போது தேர் ஆர் 2 ஃபேக்டர்ஸ், மதர் அண்ட் த பேபி. எப்போவுமே ஃபோக்கஸ் மதர் மேலே இருந்துச்சு அப்படின்னா பேபியில் உள்ள இஷ்யூஸை நம்ம இக்னோர் பண்ண வாய்ப்புண்டு. இந்த சிச்சுவேஷனில் தான் பேபியோட ஓரல் அனாட்டமி அப்படிங்கிறது வருது. அதாவது பேபியோட டங்கும் லிப்பும் எப்படி மூவ் ஆகுது. ஸோ பிரெஸ்ட்டில் சக் பண்ணும்போது பேபியோட டங்குக்கும் லிப்புக்கும் அங்கே பெரிய ஒரு ரோல் இருக்குது, பெரிய ஒரு ஃபங்க்ஷன் இருக்குது. ஸோ இந்த சிச்சுவேஷனில் தான் ஆஸ் லாக்டேஷன் கவுன்சிலர்ஸ் we start suspecting if the baby has a problem, if there is a lip tie or a tongue tie or a buccal tie that is affecting breastfeeding.
As a parent, when the child's health concerns are of a priority, as a doctor, what we go forward with is only what's best for the child. So when a tongue tie has been diagnosed, which has been interfering with breastfeeding or causing functional defects to the child, it is released. Once it's released, all the normal functions get back to being normal. But how is it released? Back in the days, midwives would go along with surgical snipping. Midwives would go with just snipping of the frenum. Little more advanced was in hospitals under general anesthesia, a tongue tie would be released. But with a lot of advances in the medical field, now laser has been used for soft tissue releases where we do a laser frenotomy to release the tongue tie. Now when laser frenotomy is done, compared to what has been done all these years, the healing is quite quicker, it's less invasive, less bleeding and no suture to the baby. So the recovery period post the release is quick. Right after the procedure has been done using a laser, the child is able to feel right away.
For this specific procedure, laser frenectomy, there might be a lot of confusions considering anesthesia or not considering anesthesia. So laser frenectomy, how we do it is we take the child, we local anesthetize the specific part which is being operated on, and this does not need a general anesthesia, which is a major benefit.
Though there's so much of awareness about how much benefits breast milk can give to mothers, the latest data from the government says only 55% of the children in India are exclusively breastfed. Now that's a huge concern. Though this concern has so many things, so many risk factors associated with it, which includes the birth and the support from the family, the socio-economic status, etc. One of the major factor which affects to 7 to 9% of the children is tongue tie. So at younger ages, children with tongue tie develop something called as compensation. They start using other muscles instead of tongue. So this has a direct effect on the ability of the mother to secrete milk. So they develop something called as late onset decrease in milk supply, and yes, mother is not the reason for that, it's the child. And now most of the time, some children who survive and who are substituted with other things do definitely grow up to be tongue tied for life. What happens with this? They grow up to be messy eaters, they grow up to be fussy eaters. Some children even choke while they're eating because of the inability to move the tongue and the oral restriction.
We did the laser. So adu panni mudichadukku apprama the baby was so much latching with me, and that is when I started feeling the real happiness of breastfeeding.
So then we went in for the procedure. It was just like barely a minute. She cried for a minute and then she fed, and she didn't seem to be in much of a discomfort at all. For the first day maybe she just slept, she fed, but then as time went, within a week or two, her reflux improved drastically to the point where I could actually put her down and she would sleep peacefully on the bed. And then I could feel a difference. The nipple soreness wasn't there, and then she was latching on really well. Her upper lip started flanging well. So overall I could make out a lot of difference.
Now I'm a happy mother. The definition or the term happiness, I can I don't know how much I can convey it to you, but a lot of different my emotions. I became a little more balanced after the procedure, and the difficulties, we speak about the difficulties, but yeah, I got an answer, or maybe I got relief after the procedure. So to whom I would talk to the mothers who are out there suffering, please don't suffer. Suffering is not normal.
Healthy baby and happy mommy. The answer is frenotomy.